Hello, my name is Lucky Word, and I am a second-year medical student at Wayne State University School of Medicine. The title of my abstract is Assessment of Sexual Health Knowledge in a Metropolitan Patient Populace, Development of a Digital Educational Tool. My team and I believe that proficiency in the basics of sexual and reproductive health knowledge is essential for the well-being of all individuals. In today's society, the prevalence of digital platforms such as social media outlets and search engines have made obtaining information about any topic of significance a very simplistic task. My team and I set out to assess sexual health knowledge, which throughout this abstract is going to be termed as SHK, and to determine how the incidence as well as the form of social communications can be used to boost gaps in SHK. The methods of our survey consist of the crafting of a 50-item survey, which was administered to consenting adults at 2 urban ambulatory care clinics. 32 of the inquiries on our survey captured demographic information, such as age, religious affiliation, race, marital status, income parameters, and household structure. Participants then were asked the extent and form of social interactions, whether they were electronic or in person, experienced on average weekly. 18 of the 50 questions on our survey were knowledge-based inquiries, with only one correct response. These questions assess proficiency with sexual and reproductive health knowledge. 1 point was then assigned for each correct knowledge-based inquiry, creating an SHK score for each participant. A minimum obtainable score of 0 was available, while there was a maximum score of 18. Data was then analyzed using IBM SPSS. Statistical significance was established at p is less than 5%. The results of our findings are as follows. A total of 352 patients completed our survey. The population had the following socio-demographic factors. 81.5% of the population was female. 84.3% of the population was of African American descent. 64.4% of the population had incomes of less than $50,000 a year. The mean age of our surveyed population was 55.3 years, with a standard deviation of 14.6 years. The mean education level of our population was 14.1 years, with a standard deviation of 2.5 years of schooling. The mean SHK score of this population was 10.2 points, with a standard deviation of 3.6 points. From our study findings, we were able to conclude that effective communication, whether it be in person or digitally, does indeed have an impact on sexual health knowledge. The association of enhanced communication and SHK values actually enables further validation of our survey. One limitation of our study was the fact that our population was disproportionately African American, and consequently, for this reason, our survey findings may not represent the greater U.S. population. In the future, we intend to test our survey in more diverse populations to further extend our study findings. In conclusion, our findings were able to identify deficits in SHK based on socio-demographic factors. We also were able to identify direct links between the quantity of digital and social interactions and SHK. Currently, supplemental research efforts are underway to develop a digital curriculum which enables the advancement of sexual and reproductive health knowledge. Overall, we hope to use our proposed e-curriculum to assist both adult and youth populations to fill gaps in knowledge. We believe that enhancing education in present populations can lead to more informed and proactive subsequent generations who experience decreased rates of sexually transmitted infections and other reproductive health ailments. Thank you so much for your time, and go Warriors!